Okay, so now we move to our second lecture, which is update on latest innovations in balance rehabilitation. So what we will talk is the update latest innovation that we have from Balai. Balai is actually balance exercise. So you can see here, I think management is the most challenging part. Management, where you have, I think you have done or listens to a very good and thorough assessment, evaluation, diagnosis, and so. And the most important thing is actually management. And I think in everybody, even patient, they don't care so much how what they are finding, whatever, but they need the outcome, the management. They need to be a cure, something like that. And it's not easy actually. You know, if you're sometimes I have seen a lot of patients like 8 years, 10 years, would they go dizziness and they just want to come here to cure within a week, within 2 weeks. So this is not really easy, and a lot of conflicts issues. And the most important thing actually, you need to be very clear whether this is central or whether peripheral. And I think the most important within the central and peripheral, I think whether this is BPPV or non-BPPV. The reason why I'm saying that is because, you know, if BPPV, maneuver, but for non-BPPV, which is more to the what we call if non-BPPV, this is more to the balance exercise. So this is the more important thing. BPPV, you cannot advise patient to do exercise, self-exercise at home. If patient after your do maneuver, you still have a symptom, it means you need to repeat the maneuver. You need to do, not to advise patient to do exercise. And you have to bear in mind, sometimes in people with BPPV, they have a mixed diagnosis. So they can have BPPV and they can have recurrent vestibulopathy, or they can have add-on diagnosis, which is migraine and so on. So that's why a physical exercise actually have been shown a lot in terms of improvement doing balance exercise. And you can see here, this is actually according to Paula 2017 by June. And if you can see here, the percentage here, 35.1% is very low. So it can be anything. It can be BPPV, it can be non-BPPV. And if you are talking now, you can see here the imbalance. If an imbalance, which is 24.3%, which is quite common among aging people or geriatric people. They just came here with what we call imbalance. And I think before this, when you are talking about imbalance, people will say, oh, it's okay because you are aging people, you don't have to do anything. You just use the scratches, you be very careful and make sure you open the light at night. But I think now, after the growing and the changes and also the innovations a lot, and I think imbalance can offer a good outcome, which is when you use balance exercise. So that's why I want to highlight here, Balai, which is a model. Now we do have 21 innovation products to help people, to assist people at home to continuously done their exercise at home. So this is what the issue. After this, if you can see, if you see people with floating sensation, imbalance, and you can advise them to do doing balance exercise after you rule out everything. They don't have tumor, they don't have stroke and everything. But even if they have a stroke, if balance exercise is still a good choice. And pre-syncope is different. Pre-syncope is something related to the low blood pressure and something like that. So this is not really balance exercise can give them advice. And for vertigo and other type of dizziness also, you should see and assess properly, and possibly they can have a balance exercise. And this is a summary. If you can see here, majority people, if you are exclude BPPV, they can benefit from balance exercise. Okay, so the reason why I'm saying the importance of vestibular rehab is actually they can give you a natural compensation, natural recovery, not depend on medication. Because I have seen a lot of, when I started my vertigo clinic on 2007, 2008, something like that, with Prof. Dane Suhaimi Side at the time, a lot of people who came and they just assume or they just consume medication, tap cinnarizine, tap mesalon, tap stugeron for 10 years. They are very like addicted. They are not settled. The symptom was not settled and resolved. But by having the balance exercise, is actually you promote people to have a natural phenomenon, which is called vestibular compensation. That's occur after anything. If they have a history of acute vestibular disturbance or chronic or gradually imbalance, so this can help you. But the most important, you need to teach your patient. They need to do rehab. They need to do exercise in patients very regularly and very patient, and slowly you need to follow the step, because our model, which you have to do step by step, start from very simple exercise, only head and neck movement is very simple. And even when I introduce to patient, people ask, doctor, how can with this head and neck movement, you can cure my balance problem. So this is the protocol they should, because we want at the end of rehab, we want them to improve slowly and not depend on medication. They can start to withdraw all the medication. That's why people who came to my clinic and our rehab center, we try to remove the medication slowly. Okay, because at the end, the central conversation implies, which is a plasticity, formations of internal model, learnings of limit, and sensory weighting. So all these things is actually very important to be emphasized and to be explained to your patients. So for example, like plasticity is actually, we try to train our brain to accept all the weakness, and formations of internal model, which is when they keep repeating, they can adapt. And learning of limit, at least they know where they can't go. They have to switch on the light. They can't go to slippery floor. And sensory weighting, which is they try to use another normal organ function, which is because in balance, you have eye, you have joint, proprioception, you have brain, and you have vestibular. So you can keep shifting to others normal. All right, so in terms of central connection, we do have vestibular ocular reflex, we do have vestibular spinal, we do have vestibular conic, all those things. So the reflex is actually taking role, important role in terms of recovery. So that's why when we use head and neck movement and we are using the exercise when standing, you are promoting and using vestibular spinal reflex and so on. So if you can see an impairment due to dizziness, is actually, it can be lots of things. It can be gaze instability, abnormal perceptions of motion, because a lot of people that having balance problem, they are having problem with motion. This is what we call visual vertigo. So altered perception of rotation, poor alignment, they can't stand for a long time, inappropriate use of balance strategy. So dizziness system, they can manifest from vestibular problem. It can from heart problem. You have to open your mind. You cannot just say if they have a balance problem, it's only vestibular. No. You can should think about others, cardiovascular, neurological, metabolic, which is in certain like diabetic patients and so on, and also autoimmune disease, visual problems. So that's why you need to do a proper and psychological disorder. And the one thing that I want to highlight is actually a lot of majority people that came to me is after they was referred to psychiatrists. They was assumed when they are telling their clinician they have anxiety and dizziness, people say, oh, you are anxiety, you are not really good. And actually, the actual thing happens actually when they start to have a balance problem, they are scared. They are phobia of the surrounding, using a car, everything. So they start to have palpitation, anxiety, and so on. So this is why people with vestibular problem having one of the current issue actually misdiagnosis and misreferral to the other department, which is can be it cannot be fair to patient. People, we keep seeing psychiatrists on psychotropic medicines and especially ubat tidur, which is sedative. So this is not really good, and at the end they are depends on that medication. All right. And the most important, the suffering you see for patients is not same as they suffer. So that's why in every patient, how busy you are, give them 5 to 10 minutes just to explain anything. Not too long, just give them. So they will tell what they feel. And you can see here, there is a lot of, I think you have done all these diagnoses like vestibular neuritis, Meniere disease, or those things. And quite surprising is that actually, I have seen, of course, Meniere disease, you need high dose beta histine and low salt diet, but Meniere disease also can be benefit from balance rehab after they have a stable position, because this also been proven by our clinical study and also case study done in USA. Okay, so what happened is actually when you have vestibular problems, so you can have unresolved sensory conflicts, you can have dizziness, vertigo, and dyscalculium. And I think this table is actually well covered enough, I think, hopefully by others lecture before. If I can summary here, BPPV is a maneuver, labyrinthine concussion rehab, which is balance exercise, Meniere's surgery, transpathemic membrane, and also vestibular rehab. And also labyrinthitis and perilymphatic fistula, bed rest, avoidance, and the vestibular neuritis. And if you can see here, majority of the vestibular disorder, whether central or peripheral, the main or optimal management is actually balance exercise. All right. So the treatment, yeah, you can be a lots of things. I think I don't want to cover more, which is anticholinergic, benzodiazepine, and so on. But be careful. The important message actually, you cannot allow patients more than 2 weeks or 3 weeks on what we call Maxalon, anti-vertigo effect, something like this, because you need to start balance exercise as soon as possible. Okay, if they are BPPV, yes, you can do maneuver and give them that mezalon, sinerazine, stugeron for short duration. After that, you remove that. All right, but for beta histine, is a differ. You can use a bit if needed. All right, but be cautious. All right. So the pharmacotherapy effect also, of course, because there's a lots of vestibular suppressions out there in pharmacies, they can buy very cheap, but you have to explain to your patient. If you are using this medication for quite a long time, it can delay, it can disturb your process of the natural cerebral conversation using balance exercise. Okay, I think I really love this slide actually. Just for more understanding for vestibular disorder patient. At the end, what you're doing, assessment, test, you do whatever, VNG, rotary chair, posturography, or whatever. But the most important basic you need to do, whether this is a BPPV or non-BPPV, okay? Whether this is like anterior, posterior canal or horizontal canal, and also whether this is non-BPPV, which is post-vestibular neuritis, post-vestibular neuritis, and also vestibular labyrinthitis and recurrent vestibulopathy. And also this is a vestibular rehab or balance exercise can be benefit. So this is most important. You cannot ask people with BPPV to do balance exercise. All right. So I think this is what happened actually when you are doing rehab, what will occur. For example, like adaptation, substitutions, and so in terms of hypofunctions of one organ, so you need to do the habituation and motion sensitivity. For example, you need to do habituation where you ask people to see a disco room, disco light, something like that. So this is the process of habituation. And also for bilateral vestibular loss, which is a substitution, also adaptation there. For bilateral vestibulopathy, this is more challenging. According to my little experience, is actually when you see bilateral vestibular loss, the speeds of recovery is very, very different from unilateral. So people or patients need to be more struggle, and they need to do more intensive vestibular rehab compared than other. And also for the central vestibular compared to the peripheral, the process of healing or conversation is a bit challenging and delay. Okay, so this is what we call my concept is actually in balance. We are client focused. We are just not follow like in the book. You just need to follow this one step by step. No, we are client focused. For example, if people say they can't drive a car because they can't turn head right and left, so our management or our rehab, which is more to the head and neck movement and something like that. All right. So this is what we call client oriented. And if you can see in this table, actually the most important thing part of balance rehab is actually head and neck, and also visual vestibular interaction, also postural stability. So these three components is very important. And normally I will advise people to start with the head and neck. Why? Because there is a research shows that if you start with the movement of the head and neck, the improvement which is more faster compared than other part. All right. So this treatment for the vestibular hypofunction, which is gaze stabilization exercise, and also habituation exercise to become more tolerant, standing, balance activities, walking, fitness. But we have a protocol. But I think that the current issue is actually there is no, before this, I think this is a global issue where there is no manual book, a guidebook where people or patients can follow properly. Of course, in internet, they have a lots of movement in YouTube, but they are only a very short video. What BalaX offers is actually our model. We are tackle from A to Z, which is we try from the head movement until the postural movement and walking, something like that. Okay, so when you are talking about balance exercise or rehab exercise, it actually can encourage vestibular adaptation and also conversation, and effective recovery from vertigo required a neural reorganization and also adaptation, and also to promote adaptation and compensations of the nervous system, and they investigate the sensory conflict to promote the neural learn. And rehabilitation exercise are particularly useful in this case. All right. And what happened is actually the cerebral conversation. Some people we ask, Dr. Zhu, how long we can improve? It depends. It depends on diagnosis, it depends on the case, it depends on chronicity that improve. It depends 6 to 2 weeks according to other research. But Alhamdulillah, we do have our current model, which is what we call BalaX quick balance, which is the improvement was, I think, less than 2 weeks, but you need to do intensive balance rehab one-to-one, and normally we admit patient in a ward and we do like 10 to 15 sessions of balance exercise. One session which is 40 to 50 minutes per session, and we can see a very huge and rapid improvement. All right. The cerebral compensation happen is actually in habituations and sensory substitution, all those things. It's a normal process that they can help people to improve naturally. Neck pain and stiffness, common side effects since movement can cause dizziness, and sometimes you can see a lot of our patients like a robot. And I have seen a lot of patients who was advised to buy a neck collar. I think this is wrong. You cannot ask because they don't have a cervical problem. If they have a cervical problem, that's another issue. But if they don't have a cervical problem, why you need them to wear the neck collar? Because the most important thing in order to promote the recovery in balance disorder people, they need to move as soon as possible. They need to start to move their head and neck movement and so on, and not to rigid the thing with neck collar MC thing. All right. All right, so when people asking you, what can I do to improve my balance? So a lot. You can do anything with walking, yoga, tai chi. Yes, you can do. But if you have a proper model, balance exercise, whatever, this is more faster recovery. And the most important thing, what any time of exercise you do is actually you need to do eye open and eye closed. So this is the key point when you ask people to do the exercise. So indication, who can use this therapy or this balance exercise? A general for vestibular loss, unilateral or bilateral, fluctuating also can, but to prepare or anticipate dizziness rather than permanent changes. Of course, for menial disease, you still need high dose beta-histine, a low salt diet, and sometimes we give diuretic like furosemide and so in non-renal failure patient, and also paralymphatic fistula. And empirical exercise or treatment when diagnosis is unclear, like post-traumatic. Now, because now I'm in neuro department, I have worked together with neurosurgeon, which is post-tumor removal, post-operation, post-head injury. Post-head injury, you should be careful because a lot of post-head injury, they have BPPV, not any other problem, all right? So multifactor disc equilibrium also in aging people can benefit a lot from. So you can change the segment. If you have seen 18 years old with imbalance, you cannot just say, oh, because you are too old, you just leave like that. No, now you can start off with them to do balance exercise because of a balai, you have a home base, you have a manual book, you have a poster, you have a video, people can do slowly. But for young people, that impact quality of life, that until they need to return to work in very short duration, you can do intensive balance rehab. Okay, you can see your nearest physiotherapists and so on. Psychogenic vertigo for desensitization, also like, psychological counseling sometimes is needed. All right, vestibular rehab reduce the severity of agoraphobia, of course, and then kinesthetic trauma, head stroke, head injury, stroke, concussions, history of inner ear problem, diabetic can benefit from this balance exercise. Okay. Anyone heard about multi-department syndrome? This is quite common, vertigo and imbalance. Then they feel like they are on board. So the management is actually, I have seen one young doctor with multi-department syndrome, which is 35 years old. They have done RF, everything, but it's failed. But Alhamdulillah, is cured with balance exercise. So this is actually one of the common, which is unclear diagnosis. People just came to you like on board. And you do the vestibular test normal, MRI 2 times normal, they do everything normal. So you should try on balance exercise, okay? So when you're saying about combination therapy, yes, I still practice this because you cannot simply withdraw your patient. You can just say, oh, stop everything because Dr. Zhu said medication can delay. No, you can slowly, during the intensive rehab, we still give them synergy, injection, Maxalon if needed during the intensive. And so, we can still see the recovery within 2 weeks actually for the home-based therapy if they do properly. And you can see this table is actually, they show the temporary changes, permanent changes, and also unknown. And the most important thing is actually, you can see stimulate, and also you can compensate the educated, all right, the educated, okay? So the type of balance exercise, before this, I know lots of people use cotton pussy exercise. Is good, it's not wrong, but I think compared the cotton pussy exercise, customized cotton pussy exercise is available in a sheet of paper. So you can imagine if you give a sheet of paper to your patient, what they can interpret themselves and how good they do the exercise. So this is a challenging thing. So that's why from that, the Balai team, this is not me alone, a team, we create this module. Now we have 70 versions of module, which is languages, Korea, India, Urdu, Mandarin. So what we did is actually, the Balai is actually home-based video module for balance exercise that available in different languages and have been tested, and we are granted grant, I think that time 99,000, to prove whether with the prayer movement and non-prayer movement, how they affect. And also VV game, optokinetic stimulation is a very useful, and I could recall here a lots of, I think a lots of gadget here, vestibular rehab, which is VV game, Nintendo VV, and trampoline, balance beam, ball, you can use. Trampoline for me is the best. You just need to ask your patient do exercise on trampoline. So this is bad. So this is the one that I think by Itakusti, I think another company also they have like Brew. So this is even it's a bit expensive, but this is kind of latest innovation that you can see. So this is our team, Alhamdulillah, Prof. Dane and also Prof. Dr. Nomani. This is my time was on 2010. It's a long time ago, and Alhamdulillah, I think my experience in clinical attachment in Central London, 2006 and 2007, I back to Malaysia, and this is, I just want to share what we do have actually. Now we have 21 products where we started with this module. The first, I never think my product is actually my book, my manual book, my poster, my CD is an innovation. I never think, because I just make it to my patient, because at that time my patient was not treated with a physiotherapist, because that time the physiotherapist not offer the balance exercise. But now, Alhamdulillah, they are keep moving. So we do have ballet stroke, we do have rotary chair, not for assessment, but this for rehab. And we do have stem out, which is we use car tube for rehab, and we use wheelchair, which is for stroke people, and we have ballet foot, which is shoes to help stroke people, and we have disco room. This is what we call mobile virtual room. This is a very small, like a changing room, and it's a very nice, and it is very complicated, because when you're putting vestibular disorder patient inside this room, they will came out with very severe vomiting and so on. Okay, and we have ballet physio, and we have optokinetic drum, and all those things, and we have foam. This is the most important thing. I think if you want to have a vertigo clinic or rehab or physio, the foam is very important, because this is the one before and after. And I have a latest module. This is what we call ballet quick balance, and this one is our latest one. After 10 years, I'm creating ballet. We have this module quick balance, which is a combination, not only customized cotton could see, but we have our latest module for ballets, and we have adds on all the virtual disco trampoline here. And this is the one that we use for one-to-one session and so on. And we have ballet accessibility. As ballet accessibility is actually one of our tests for autolysis, which is for utricle and secure. Is a very simple test, a very quick test, and it is very interesting. And we do have ballet quick balance skeleton tracking, and we have ballet dance at CD dance also is more enjoyable, and we have a silent stroke chart, which is for those who are stroke that have a problem to speak and something like. All right, so this is a good for family member, also for patient, and we have balai solat soon in progress, and those things. And this is our virtual rehab clinic that we practice. We are normally like to use light as a challenging, and I think this is the one in Kuala Lumpur, if you could remember. I think this is the concept when you're doing a balance exercise. The more challenging surrounding you give the patient, the more faster recovery that you can see in your patient. So this is our ballet module that we do have in multiple language. Yeah, and our module is actually, Alhamdulillah, have been accepted as a protocol in Bosnia and Turkey, and because this manual book also having in this version. And this is the poster, and this is the summary of the movement. And of course, when you have doing the exercise, they have a contraindication, which is low blood pressure, medication reaction, migraine. Some people we don't, but some research show that migraine also can benefit from balance exercise, TIA, and also BPPV. Yeah, BPPV you don't have to apply then with the balance exercise. So this is a research grant, RU grant. We granted 99,000, and the study shows that there's not much changes in Malay vision vertigo symptom scale, and also mini mental state as mentioned, but there is some improvement in terms of psychological, which is more to the calm and psychological influence in patient with using prayer movement. compared to the non-prayer module, which is the customized quote-unquote exercise. Okay, so this is a form. I think this is a very important form that you need to pre and post assessment. And I think, Alhamdulillah, for the Balai Quick Balance, we have done a lot of like achievement, and this is a quick. People can improve their balance quick if they follow our protocol, and this is our standout, which is our innovations that using car tube. And this is our ballet dance, and this is like a summary. I cannot show everywhere because I think my time was limited, but Alhamdulillah, at the moment, ballet is already granted more than 44 awards, local and internationally. And the latest one, we do have Balai Quick Balance skeleton tracking. This is more enjoyable because skeleton tracking, because there's like a robotic, we can do the exercise, and some software will guide whether this movement is wrong or right. Okay, so this is all at the time what Balai did is actually we have done a lot of community sharing, international, and we have, I'm also one of the invited lecturer in the postgrad diploma in Dubai. And we've been traveled to Turkey, Bosnia, and London, Paris. We do a collaboration, we share our protocol, because at the end, our hope is actually we want people to benefit from what we're doing. And Alhamdulillah, since this year, since 2020 November, USM has been off company for Balai. This is what called Balai's Balance Rehab Syndrome Berhad. So we are invited all people who want to collaborate, to be our partner, to be our collaborators, to be our whatever. So this is a good chance because the Balais have their own company, and we do have our center in Kota Baru, Kelantan, which is beside the USM. This is what we call Malaysian Balance Center. Balance and Stroke Rehabilitation Center, and we offer free balance screening on Saturday and Sunday. Walk in with our trainers. Please welcome. And this is our committee. So we do have our company for what we call for business, and we do have also for community. And that's the most important thing I want to highlight here now. We do have Balai Virtual Balance Consultation and Rehabilitation Clinic, and because this is online. This is online. So in this online is actually everything people can get. People can have or the virtual if they can't come and see us. We offer the balance online or virtual rehabilitation also consultation. And Alhamdulillah, until now we do have a lot of good what we call requests. We do have a patient from Qatar, from Myanmar that requesting for this thing. So we are growing. So thank you so much. I'm delayed for like 2-3 minutes. So thank you so much. Thank you so much.